Breast cancer is such a frightening diagnosis. It starts with the patients feeling like so much has been taken from them, the shock, the fear. And then when everything's done, they're left without their breasts anymore. And really that's part of their identity as a woman. And it's really important for them to feel like we can restore that and bring them back to their daily activities that they were used to.
I think it's important in the breast reconstruction process for patients to hear about breast reconstruction, whether or not they think they want to have it.
The insurance companies are mandated by federal law to cover breast reconstruction for cancer patients, and this can happen at the time of mastectomy. It can happen at a later date. There's no limit on that. Without that law, many women would not be able to afford breast reconstruction without insurance coverage.
First, they have to get through the cancer, and that's a hard process. And it's kind of like looking down this long tunnel, this journey you have to go through. But there's some light at the end of it. And the breast reconstruction, I think for a lot of people, not all, but for some people, it is the light that keeps them going down that tunnel.
Breast reconstruction means getting back to a sense of self, getting your body back, being able to fit into clothing, go swimming, hug your family, and just feeling like yourself.
We know that from multiple studies, patients that go into breast cancer treatment and come out with their reconstruction started have a better outcome. They also do better if they understand what the reconstruction options are and see pictures and different options available to them before they undergo their mastectomy.
We have comprehensive services available for patients who are diagnosed with breast cancer. It doesn't matter who they are or how much money they have or where they're coming from. They're going to have all of the best options for them available. If their insurance is covering their mastectomy, their insurance is going to be covering their reconstruction, and they can have really every reconstruction option that's possible right here in the Green Bay area.
Our job is to educate and let them make a good, informed decision so that when they're all through, they look back and say, whatever course of action they chose, that they did what's best for them.
Really, I'm just there to help. And so as a reconstructive surgeon, I probably see the patients more than their oncologic surgeon because the breast reconstruction takes place in so many stages, and there's before and after visits.
For many of these patients, we see them annually for life, just to make sure everything is just how it should be, that they're not having any problems. And that's an important part of the care that we give.
I get to know these people, and it's their comfort level to put on that swimming suit and go out in public. And so if I can help them with that, that's great.
Watching that transformation from someone who comes in and is very upset about their diagnosis, and then seeing them go through their treatment and being there to help them in whatever way we can overcome that whole disease process is very rewarding. It's extremely important for a patient to trust their physician. I can tell you that for me as a surgeon, most of my patients are asleep when I operate on them. So not only am I there to do what I think I need to do to help them, I'm also there in some regards to watch over them and to make sure that if there's any problems that it's all taken care of. Really, our overall goal with breast reconstruction is get our patients back to doing whatever they want to do in life.